Good morning. I'm Max Fuhrmann. Welcome to the first show of Age Well. Not how to age well, but just age well. And probably a lot of you are doing that without even realizing that you're doing that. I'm Maximilian Fuentes Fuhrmann. My father named me Maximilian because he wanted me to do great things, and so I respect that he did that, this huge big name. I'm a clinical psychologist and gerontologist. And what's a gerontologist? Somebody that knows about aging. Aging actually starts at conception. When I was looking up definitions of aging, what kept coming up was a march to death, like this slow decline to death. And I thought, my goodness, how about the beginning of life? That's all aging as well. So I have a practice in Beverly Hills and out in Westlake Village, but the real reason I'm wanting to do this is not for my practice, really to help all of you understand what aging is and what it's not, because there's so much misinformation out there. We try to make these programs very timely. I'm going to read from Sam Farmer of the Los Angeles Times talking about Tiger Woods, who today is Tuesday and back on Sunday. He won the Masters, as a lot of you know, after going through horrendous pain and debilitation from surgery. But Sam Farmer of the LA Times on the 15th of April 2019 says, Woods feels the effects of age, of course. He's had 4 back surgeries. He can no longer keep up with his kids the way he once could, but he's adapted his game too. It's like, Mr. Farmer, that's not age. Tiger Woods was a prodigy, so he's been playing golf since he was a little tiny child. Imagine, if any of you play golf, the repetitive motion. It's like working, I'm comparing Tiger Woods to a manual laborer, doing the same thing over and over and over again. So his body is broken down. It's remarkable, again, that he's come back. He talks in here in this article, Mr. Farmer, about in an era when a 41-year-old Tom Brady can win the Super Bowl, right? That would have been when I was a child. I'm almost 60. Unheard of, somebody 41 playing a contact sport. Woods has proved he's entirely capable of keeping pace with and surpassing younger competition. After all, Tom Watson almost won the British Open at age 59. And he says, when you ask a lot of people who are really doing well with aging, what do you attribute it to? So Tiger says, quote, I think it's training and nutrition. Exercise programs have changed. They have progressed. Guys are able to take care of their bodies for a longer period of time. So he's attributing it to exercise, nutrition, and certainly motivation. He goes on and talks about in this, quote, in this sport we're able to play a much longer period of time, and you're just seeing guys that are better able to take care of their bodies. So this is his interpretation of how he's able to come back at the advanced age of 43 after being gone from the sport, essentially in contention for quite a long period of time. So that's a lot of what these shows are going to be about, is real world examples. I'm a professor. I taught for almost 20 years at Cal State Northridge and Cal State University Channel Islands, California Lutheran University, and currently on adjunct faculty at where I went for all 3 of my degrees to USC. But I try to make things for the average person. My father never graduated from high school, and he was very much kind of, we could just say, marginalized because he didn't have all the alphabet soup after his name that I have. But I have learned the most actually seeing clients since 1982 from my clients, the wise elders. The basic message you're going to be hearing over and over again is empowerment of older adults, what aging is and what it's not. And when I looked up online, what is aging? It says to show that we are biologically immortal. That's why we age. And it said it could even be positive. Well, when you're a little tiny kid, right, you want to be 5. So people ask you, how old are you? I'm 4 3/4, people will say. Nobody says that they're like 79 3/4. Here we are in Hollywood, and we know that we don't age well in Hollywood. We try to actually slow it down, reverse it or I'm going to be having a show in the future on all these, quote, anti-aging treatments. I know one of the viewers already had asked, am I going to talk about Botox? And you're not going to hear me promote anything that's against aging on this show, because aging, like in nature, is a natural process. And sorry to all you folks out there that it's a billion-dollar industry, I know, to be against aging, but we're aging. So you could change the outside of you, but the inside of you is still aging. So we're going to be looking at different images of aging, and so now it'd be good to show one of our images on the slides. We'll be showing you some slides today. This is a picture from Florida where it's outside of where older people, I guess, walk, and it says Geyser Crossing. And I found that so funny in a variety of ways. We have crossings that says like slow children, so you slow down. Geyser is a very pejorative, negative word about seniors. This generation, the World War II generation, is sometimes even referred to as the greedy geezers, because some of them have actually made more money in retirement than they did when they were working. They've actually gone up like a socioeconomic class. But the idea that a state or city or county, wherever this is in Florida, that actually paid money to make this sign, and the man's just kind of embracing it there in the picture. So that's one view of aging, to see yourself as separate, to kind of internalize the ageism, which is a discrimination against people on the basis of age. I know someone was just talking about how in the upcoming presidential candidates that they're talking about some are too old to be running. So that's an example of using age in a discriminatory way. Because I love to say that we would only know if we're too old to do something if we knew how long we were going to live. And nobody can actually tell you that. You can take life expectancy tests. You can Google that. The best one actually is probably the Harvard University life expectancy test. But even that's just a test. So if you knew that you were going to die a week from now, you might live the next week very differently. But nobody really knows that. So when we look at the idea, again, of this kind of ageism in our culture, it's no wonder that there's so much misinformation and that people don't want to become like this geezer kind of fellow. The next image that we have to show you is the opposite, where we hold up images of people that are defying aging. And this is Dr. Jeffrey Life, even though I don't think that was his given name, but if it was, he's a lucky fellow. That he's a physician, and he practices one of the terms that I like, age management medicine. A disclaimer in our show also is I am not a physician, so we're not going to be giving any medical information. If you have medical questions, we will do our best after the show to give you information and referral to other resources. As a psychologist also, you are not my client, so I don't know you personally, so I can't advise you in that way. But one of the things that I certainly do as a gerontologist and psychologist is to give people information that I don't necessarily have, find people that can give it to you. And here, certainly in big urban areas throughout the United States, there are geriatricians. Those are geriatric specialists, and those are usually the best people to see. We're providing that information for you as you're needing it. So in this slide, we see this physician, Dr. Life, who earlier in life was actually overweight and not in good physical shape, and really started practicing this age management medicine. And what a different image that is. But I never want to also get carried away in glorifying a person who's defying aging, because then that's also kind of the opposite. It's like saying, well, they're not really aging, they're just amazing kind of how they are. Sad to say for all of you, we now believe from our research that the best predictor of how long you're going to live is how well you picked your ancestors. Some of you are old enough to remember these two people, Jack LaLanne, who was a big exercise guru person, and George Burns, who was a comedian. George Burns suffered this traumatic loss of his wife, Gracie Allen, and lived another 20 years after that. He was known for smoking cigars and drinking martinis. He performed into his late 90s. He was an age contemporary of Jack LaLanne, who had actually inherited in his family a lot of heart disease. So when he was a young person, he decided he was not going to smoke, he was not going to have flour or sugar. He was way ahead of his time. One of the stories about Jack LaLanne is he wanted to open a gym in Manhattan, in New York City, and didn't want to allow people to smoke cigarettes. And they said, oh, well, that was silly, because cigarettes, you needed to have a great smoke, like after doing exercise. So that was the view back in that day, and some people still might say that cigarette smoking is not necessarily bad for everyone. Certainly in really old people who have been smoking a long time, like George Burns. So the point is that George Burns lived longer than Jack LaLanne. Here's this man that dedicated his life to exercise, but he couldn't really outrun his genetics. And George Burns obviously had the genetics to live a long time, despite going to visit his wife Gracie after this tragic loss, which is really, really hard on people to lose the love of your life. For everyone who's fortunate to have that, it's then not fortunate when they pass. So what we're going to focus on today is just some basic concepts about what aging is, because when I show this to students, they're like, oh, this is so depressing. But I think information is better kind of to know. Most of you have never taken a gerontology class, have never formally really investigated what does happen and what doesn't happen. As I'm saying, Mr. Farmer of the LA Times, you've conflated actually disease with aging. Tiger Woods had back surgeries, he had knee surgery. That's what we call pathology. That's probably from wear and tear. That has nothing to do with aging. Aging is a normal process, and aging starts at conception. All of you that have children know that there's this constant like growing, developing, whatever, and we embrace that, right? We love younger people in this culture. One way I feel very discriminated against here in the Los Angeles area, you can go to like film screenings and they want your opinion and they want to know your age. So they have all these boxes for you to check, like, are you 16 to 18? Are you 19 to 22? Are you 23 to 25? And then it will say over 50, like, everybody over 50, you're all the same. We don't care about your differences, whether you're the baby boomers like the 60s generation, my generation from the 70s, people over 85, people over 100. We're literally just all glumped together, kind of. There's my word, glumped together, clumped together. And so you can really end up feeling like you don't count and you don't matter. So I want you guys to feel like you do count and you matter, because as all of us boomers know, when we're all over 65, there'll be more of us seniors than have ever existed in the history of the United States. And that can be a good thing, that can be a bad thing, but I just want you to know some of the facts about this. Certainly the people in the 60s generation, right, you grew up with Pete Townsend of The Who saying, hope I die before I get old. Don't trust anybody over 30. Well, now all of you guys are significantly over 30. And what does that mean for you? So we're now going to segue into some of these slides to just show you what, quote, normal aging is. Normal means, in a statistical sense, it happens to everybody. And it's a pretty short list of things that actually happens. Aging itself doesn't really start to catch up with most people until they're about in their mid-30s, meaning that until that time there is continued growth. You get faster, you get stronger. You see this represented over and over again in professional sports, that people mature from their early 20s to their mid-20s to their late 20s. But this is why they're talking about Tom Brady, the quarterback, at 41. That would have been unheard of decades ago, that someone would be at that top level in their 40s. So the decline starts mid-30s. So our first slide starts in the 40s. Some of you can thank your ancestors for really changing in body type as you get older. You may, quote, have fat in places that you never had before. And we know certainly in this culture that some people deem fat phobic, that we're not really nice to people about that. So you eat the same food and you just don't burn calories the way that you used to. And then if you stress out about how you burn the calories, we're learning in science that you make even more fat cells and cholesterol from worrying about being overweight. A lot of these really elderly people, when they ask them, have you watched your diet? They look at the camera and say, no, I've enjoyed life. And that's back to that thing with George Burns. He did things that are not supposed to be healthy. He smoked cigars and drank alcohol. How come he lived to 100? Because everybody's different. All of you that are height challenged, you may start to get a little bit shorter, hence the stereotype of the little old man or little old woman, and the idea that we know that shorter people can be discriminated against. There was a song years ago about short people have no reason to live. So we tend to think of shorter people as almost like infants, and there's a lot of that in the culture, right? Little man, little woman, honey, sweetie, dear, all these kinds of things, very pejorative things that we do. Some of you know of Maya Angelou, and I have this clip I used to show in some of my trainings where this young woman is going to ask her a question and calls her Maya, and she's so upset about that and says, you don't have a right to call me that. I am your wise elder. And yet how many people refer to seniors by their first name? I'm half Mexican. I was raised, we respect the seniors. I would never call somebody who's older than me by their first name, but I hear this all the time, along with the idea that somehow because I'm younger, I know what's better for you. And all of you that have children out there, right? How old do your children need to be that they come to know what's best for you? Old saying. I love old sayings. One mother can raise 10 children. 10 children can't take care of one mother. And then it says in your 40s, farsightedness begins. And for all of you out there over 70, probably that was the case for you, that you had to wear glasses. You could go to like a drugstore and get these magnification glasses. But what we're actually finding is fascinating is that for those of us of the 70s generation of boomers, we're not developing this at all. And the current theory, and a theory is just a fancy way of saying guess, is that we were the first generation to grow up watching television. Television was on, right? I grew up in San Diego. We had 3 channels, and we could watch pretty much all day long, not at night. It used to go off at night. Some of you remember that. But it did something to our vision. So a lot of us, like in middle school, junior high, we're wearing glasses because we couldn't see in the distance. And I still can't see well in the distance. But it's fascinating that something that we used to take as fact about this farsightedness, not being able to see up close, is actually not the case in my generation, first generation. So now people are wondering what it's going to do with all the younger people growing up looking at their phone and looking like this all day, what that is going to do to the eyes as they're developing. So in the 50s, there's a lot that happens hormonally, and not maybe though as much as people would assume. We're going to be doing a little piece in the future on Okinawa, where people live longer than any other place on the planet. It's an island off the coast of Japan. And their people don't seem to have hot flashes or issues associated with menopause. Menopause itself, for all the women out there know, that you get to where you're not able to become pregnant, that there's hormonal changes, you no longer menstruate. And if that, again, is very upsetting to you, as you're thinking like, now I'm not young, I'm getting older, that in of itself can enhance this tendency to have insomnia and the irritability, crabbiness, difficulty concentrating, all those horrible things that can happen with menopause. And that slide goes on to about andropause. What the heck is that? That's where men's testosterone level is less than it once was. And for several years, not that long ago, men were being prescribed testosterone, which is the primary male hormone. And the drug companies were saying things like, wow, this is going to make you feel young again. But now we're coming to realize that men didn't need to take testosterone, and that it actually can have some negative side effects like making your blood really thick and creating problems with your prostate, which a lot of men have issues with their prostate. Anyway, we're not exactly sure why that is either, because you don't see that around the world, particularly in some eastern parts of the world. So your sex hormones continue to decrease, but that's not necessarily a bad thing. I love to tell my clients about things like, they're like people that make me seem big. I'm 5'2", I weigh 125 pounds. I have clients that make me seem big, and they're taking extra strength over-the-counter medicines. They don't need extra strength anything. They need less strength. would you give like a 5-year-old the same medicine that you would give to a 25-year-old? Of course not. So why would you give the same dose of medication to someone who's 85 years old that you would somebody 25? So the idea that you have less in your sex hormones is not necessarily a negative thing. Some women actually embrace the idea that they don't have to worry about pregnancy. Some men also like the idea that it's okay that they don't need to really feel as robust as they once did in terms of the competitiveness. And that in and of itself can enhance them being better listeners and communicating better and not feeling as much of this kind of competitive male, quote, drive, which can be fueled by testosterone, certainly taking external testosterone. Lessening ability to see in contrast in dim light or glare. And all of you out there in your 50s, you know about that. You know that it's more difficult to see at night. So one of the things we're going to talk about on this show as well is where's the best place to retire. You do not want to retire like out in the mountains or out in a rural community where it's really dark at night and then you have trouble seeing, like when you're driving because the headlights coming the other way are really, really bright in the darkness. Best place to retire, a big urban area where there's a lot of ambient lighting. The next thing probably most of you have never heard of, my friend always says it sounds like a country, right? Sarcopenia. Sarcopenia is the age-associated loss of muscle strength. And so if you don't do anything to offset that, you're not going to age well. So people that think that they can be sedentary all day, you can do that actually in your 20s. I know people now say like, sitting is the new smoking, even for younger people. But in your 20s, if you sit all day, it's really not going to have as deleterious, as negative effect as if you're in your 50s. Like so many of my friends that say like, oh, I can hardly move after I've been sitting all day. So even if you just get up and move around for a couple minutes, once an hour, makes a big difference. And your vulnerability to illness is heightened. So we know this certainly as you get even older. The flu shot now has different strengths for people over 75, over 85. One of the hallmarks of aging is you're more likely to become ill. But it doesn't have to be that way if you're mindful that this is going on. So old-fashioned ideas, right? Early to bed, early to rise, getting enough sleep. We know this has become like this epidemic thing now that people are watching what they're eating. I mean, talking about younger people, watching what they're eating, exercising, but are chronically sleep deprived. When I give lectures to younger people, I ask them to raise their hand if they got enough sleep last night. Out of maybe 1,000 in an audience, 2 or 3 people raise their hand. So we're learning again, if you're not getting a good night's sleep, what's going on that you're not getting a good night's sleep? A lot of things to look at with your medical doctor or with a sleep doctor to try to really focus on that. If you don't get a good night's sleep, you're far more likely to develop illness. It's really hard on your immune system. So as we go on to the 60s, this is what a lot of boomer people really notice. Their hearing is not so great, but that's really not as much just from aging as it is being exposed to loud music. So it used to be like in the World War II generation, you'd see people with hearing damage from loud noises in factories when there wasn't as much control over that, people that were pilots, people that had been in combat. But now we're seeing in general in the population, the 60s generation, the 70s generation, we went to concerts where our ears would ring afterwards. And I know growing up in San Diego, we used to think, oh, that was so exciting. What was actually happening is we were damaging our hearing. And I need to tell all of you this terrible thing that the body holds its history. So if you have had injuries when you were younger, you have done things inadvertently to harm your hearing, it catches up with you as you get older. And all professional athletes kind of know that, right? This was the thing even with Tiger Woods. All the repetitive motion has caught up with him. High frequency sounds, so you may have trouble hearing like little tiny children or women whose voices can be higher. A lot of the newer hearing aids are trying to get better at addressing that, but please be kind and nice to people wearing hearing aids as they get older. It's not like wearing glasses. You don't just put them on and say, wow, I can see so much better. You're often not aware of how much you have not been hearing, And so all of a sudden now everything is amplified. Or that people think, oh, now that you're like wearing your hearing aids, you can hear me perfectly, even when I'm in the other room talking to you, or talking like when there's music playing or television playing or a podcast playing. No, as you get older, you have a lot more trouble hearing unless somebody is standing right in front of you. Your pancreas is not as efficient, and that's a lot of what plays a role in your insulin and your blood sugar. And again, I'm not a physician, but as a gerontologist, I can speak to how important it is that your blood sugar stays consistent. So a lot of my clients, often they come in, my elderly clients, they say, well, my family is concerned about me. Maybe they want me to go into like a care home. So I tend to ask them, what do you eat for breakfast? Because breakfast, we used to say, you eat breakfast like a king or a queen, and you eat your midday meal like a prince or a princess, and your last meal like a pauper. A lot of people don't do that. They go all day long and they eat hardly anything. They eat this huge meal at night. That's so not good for your blood sugar. In the morning, you want to eat high protein kind of food. Nutritionists, that all of you older people with Medicare will pay for you to work with a nutritionist to tell you about eating high protein breakfast. No banana, no cereal, no oatmeal, none of that kind of stuff. Because as we get into about like 10:30, 11 o'clock, you're going to start to feel very sleepy from eating all that kind of stuff. And that affects your cognition, it affects your thinking, it affects your brain in so many ways, as it does when you're really young, right? You go to school and you didn't have a good breakfast and you notice the difference in that. Wear and tear of the cartilage. So how are you exercising? A lot of boomers, we don't want to get old, so we're pushing ourselves and exercising. We're exercising like a young person. We're not really mindful of managing aging. Who wants to do the things that I do when I walk my doggy? Wear knee pads and put supports for your arches, or change your shoes every 3 to 6 months. That's a lot of bother. But I do that so I can walk 4 to 6 miles a day on pavement, which is very hard on you as you get older, doing pounding. All you runners know that. So just these simple kind of things of making these modifications before you have a problem can make a huge difference. But if you're in denial of aging and saying like, no, I'm a young 59-year-old, I don't need to do those kinds of things, then it does catch up with you. Then you need to have surgery. And once you do anything in surgery, in my experience, obviously you're not the same. That's potentially an area of weakness unless you're fortunate enough to be like a professional athlete where you're getting all these people to work with you in training and nutrition and whatever. And a lot of folks obviously don't have access to that. Not very many things on this list, right? It's a pretty short list. And these are just the things that happen. There's not all these big long lists of diseases where people will say, I have like age-associated pain in my finger. And so if you don't remember anything else from today, I want you to remember my old joke that the man goes to the doctor, or the woman goes to the doctor and says, like, doctor, my hand is just so sore. I can't get out anymore. I can't do the things that I used to do. My daughter wants to put me in a care home because I'm so upset about this. And so the doctor says, well, ma'am, sir, you're 85. Like, what do you expect, So I'll give you some, like, ibuprofen or anti-inflammatory medicine, and you take that, and then come back and see me in 6 weeks. So the person feels so upset because now they've been told that what's wrong with them is aging. And aging, you're just going to get even older. So 6 weeks, you go back to see the doctor, and you're 6 weeks older. But the person asked the doctor one question, and I know sometimes it's hard to ask physicians, if you didn't go to college, or this doctor is a medical doctor. And so you're very intimidated to ask a question, especially if what they said didn't make sense to you. So you ask the doctor the question. You say, Doc, I know that this hand is 85 years old, but the other hand is the same age and it feels just fine. So that's always your test for what we call ageism, being treated differently because you're older. That makes no sense, right? Pain is not from aging. All these people that we're going to be talking about in this program, the super centenarians, the super agers, over 100, over 110, they don't have pain. This woman, Virginia McLaren, who danced with President Obama, she was 106, 107 years old. She didn't look like she had any pain. So don't let doctors get away with telling you that something that's going on with you is from age. Continuing on to our next slide. 70s, right? That's sounding really old to some folks out there. Your blood pressure may be higher. What the heck does that mean? It means that your heart is not the way it used to be. It's a muscle. It's weaker. And so it compensates for having your blood pressure be a little bit higher. This is not necessarily a bad thing. The body tries to heal itself. All of you know that when you work out like on a machine of any kind, it's supposed to be reading out things about you personally. So a lot of geriatric doctors that I work with, they won't give you blood pressure medicine unless your blood pressure is consistently 145 over 85. If you were younger, that would be a very high blood pressure, but that's not as you get older. Your reaction time is slower, and there's really nothing that you can do about that. It's kind of like Tiger Woods was talking about. He's not going to, as he gets older, hit the ball as far, but if he hits it better and doesn't hit it in the rough, in the bunker, in the water, then he does better. So we see this in aging athletes, that they compensate for a decrease in reaction time. But what that means is your driving is also going to be different. It's the most dangerous thing that most of you do is drive a car. I look forward to having self-driving cars and taking things like Uber and Lyft. They have a new one called something like Grandpa Go for older adults. So again, it's the 21st century. We're going to have all these technological changes that maybe will make it so we don't need to drive. You cannot be a commercial airline pilot in the United States and be over 65. That fellow Scully that landed the plane on the Hudson in New York, he had to retire shortly after that. So you get slower. And life is not a race, hopefully, when you're in your 70s. So that's okay that you're slower. Your short-term memory. We're going to have a whole lot of shows on memory. Just need to pay attention. Attribution is very different when you're older. You forget where you parked your car, and people say, your children should take the keys away. You can't drive anymore. If you're a younger person, you forgot where you parked your car, people think it's okay. You were just interested in going into the mall to buy something. We were late for work. Totally same behavior, very different attribution. And your thermoregulation is not as efficient. So what that means is that you're going to live in a place like Florida or Southern California. If you go out in the ice and snow, you're at risk to have a stroke. It's much harder for your body to regulate temperature as you get older. Going on to your 80s. All of you that struggle with weight, yippee, now you're going to be lighter because your bones are actually going to be thinner. But that's more of an issue in terms of you falling down. So people who are more sedentary, far more likely to fall down. This reaction time also is really a problem because if you trip over something, you can't catch yourself as quickly with this slower reaction time. In your 70s and into your 80s, you can be 3 to 4 seconds slower than when you were younger. That's 1 1,000, 2 1,000, 3 1,000, 4 1,000. That's a long time if you're trying to catch yourself from falling. Half of the people may get Alzheimer's disease, but the current research suggests that we don't even know what Alzheimer's disease really is, that maybe it's more than one disease. So notice I say may. And when I was at USC, they had told us that by the beginning of this century, we would have Alzheimer's disease all figured out. We know so much less than we thought we actually did. So we're going to do a whole show just on Alzheimer's disease. Your heart rate is not as fast as it was when you were younger, so you do not want to stress it. If you're on a treadmill or an elliptical or even going for a walk, you want to be mindful of not pushing yourself. Again, a mindset for when people are younger is, I'm going to the gym and I'm really going to push myself. One of the things I do in my spare time is I try to teach spin classes, these like exercise classes on stationary bicycles. And all the bicycles have a little chart on them, as do your machines that you're on, like an elliptical or a treadmill, that talk to you about how fast your heart should be at exercise. And that's a real problem if you're like pushing yourself to become what's called anaerobic. You're actually breaking the body down. So the point is that in your 80s, maybe just walking around your living room is enough exertion for your heart. If you're in your 20s, that wouldn't be much at all. So the story of so much of this is less dosage of medication, less real effort of like pushing yourself. You don't have to do as much, but you do got to do something if you want to manage aging. And this last part on the 80s, we become more like ourselves. So all of you out there that are big, like into exercise, you get a lot out of it. You'll continue to be like that. All of you that are couch potatoes and don't really want to move around, maybe that's how you're always going to be. It's not up to anyone to tell you how to age well. That's why this show is not called How to Do It. It's embracing what you're doing. And I, as a gerontologist, not only have great respect for everybody out there over 85, but you're doing things well. Don't let younger people tell you what to do, because they're not even where you're at yet. You figured out how to do something well with regard to taking care of yourself. And what do we know about people over 90? Well, there's a study that came out from, used to be called Leisure World. It's now called Laguna Woods down in Orange County, California, south of Los Angeles, where we have this huge group of people in their 90s. So they started to look at with them, what do we really know about folks? These are mostly white and Caucasian people from Southern California, so that's like a caveat, kind of like a disclaimer there, that maybe that doesn't apply to people of other races or backgrounds or ethnicity or different parts of the country, different parts of the world. But what they pretty much found in these folks is they just did what they did. Some of them took vitamins, some of them didn't. Some of them exercised, some of them didn't. Some of them were smoking cigarettes, some of them didn't. It's just not one size fits all. But overarching with all of them, we found this mild disposition and tranquil character. So if you hold on to a lot of stress and you come from a family that's kind of like genetically or behaviorally set you up to do that, that's going to be hard on you in terms of aging well. Remaining physically and mentally active, and you can take that to mean, again, anything that you want. We used to believe that just becoming like mentally active was enough. So you could sit and watch a lot of these programs on television, games, that they have on television, or even doing things on your phone or on your computer, video games, whatnot. But we're now believing that moving around from the neck down is far more important, if you had to pick one thing, than just doing cognitive brain stimulation. Like so many ancient things, they come to be true. We've also discovered in research that doing new things with your brain is far more helpful than doing the same old thing. One of the hallmarks of middle age, if you're quote a successful person, it's kind of like me saying, like, I'm a psychologist for almost 30 years, I can do this. My wife would probably say I can do it in my sleep. It's just mastery, and you keep doing the same thing over and over again. That's not what you want to do. You want to do new things. Like me doing this show is like a new thing. Getting out of your comfort zone, pushing yourself, being open to taking criticism, suggestion. This is really, really like old concepts from 5,000 years ago. But we can now see inside the brain that the brain is forming new connections. Drive a different way home. Take Lyft or Uber. Take something that you've never done before. Challenge the brain. Challenge the body to do something it hasn't done, if you want to. Taking naps. This is very much associated with taking care of yourself, right? We are now this 24/7 culture. And I travel to do these lectures around the state pretty much. What I find is people sitting there working. They're all working now, 24/7. It can be Sunday afternoon. When I was a child, everything was closed. People didn't work on Sunday afternoon. Now we're expected to work. People take things on vacation. I do a lot of hiking up in the mountains, and they want to have all these cell sites now where you can be online up in the mountains. There's something that's just, this to me doesn't seem like that's the way to age well, to be constantly like working and on. And the last piece of this is staying engaged in the outside world. And now with this technology, even like you guys who are accessing it, honor yourself, congratulate yourself that here you are. Technology, that when we were children, when you were children, you could never explain what you're even doing to your parents. It's amazing what's happening. So I have clients that connect with people from grammar school, elementary school, they haven't talked to in 80 years, and how exciting that is for them. Because it very much used to be that people were isolated. They were stuck in the house, they were physically unable or financially unable to get out of their house, and now you don't have to. Now you can sit there in your comfortable chair. Hopefully it is comfortable for you. And we're talking about furniture at some point on this show also, and that's a way to age well, is to make sure that you have things that are supportive of you, that from your couch or even from your bed, you can connect with the outside world. The best way to age well is not accumulate wealth, to not accumulate anything like physically, tangibly. It's not even to have health. It's to have a lot of social connection and social contacts with other people. That comes up over and over and over again. So as we wrap up our first show, you've had a little bit of introduction into what actually aging is. And gerontology itself is a bunch of topics. I'm going to be having a guest on every single month on the show, either somebody to talk about their own experience with aging, or to talk about as a professional what they do to help people with, quote, the aging process. Aging is not a disease. We do not take medicine for aging. If you have a disease, that is a separate phenomenon. And just like in the beginning of life, we are more likely to have disease. In many countries, if you reach your 5th birthday, that's a big thing to celebrate. Same thing on the other end of the lifespan. But if you learn again how to manage aging, it's not a negative thing. Changing demographics, as I said, there's going to be all these older adults. And percentage-wise, it's now going to go from about 10, 11% of the population up to maybe like 20% in the next few years, because the declining in the birth rate, along with all us boomers, after World War II, huge amounts of people being born. So I think it's very timely in a way that you're able to hear what aging is and what it's not. We do not want to have people believing that life expectancy is the same. One of the charts I have here reminds us that in 1900, people only lived to 47. Dr. Sigmund Freud said you couldn't do psychotherapy with people over 50. He wrote that when the life expectancy was 48. Now a child born in 2019, the average person is expected to live to almost 80. So what does that tell you? If you're going to retire at 65, you're going to live another 15 years after that. Retirement is also something we're talking about on this show. What does that actually mean to retire? And how do you stay engaged in the outside world? One thing I might ask you to consider doing is drawing a picture of yourself as a senior. How do you see yourself as a senior in the future? And if you are a senior, are you actually living life the way that you're wanting to? Who were your role models for getting older? A lot of white and Caucasian people only see their grandparents twice a year, so they don't really have an image of how to age. So either they're getting it from media, these stereotypes of seniors advertising medication, burial plots. Help, I've fallen, I can't get up is one of my favorite ones, this terrorized woman that's fallen down. Or they have images where they're just, these super agers and they can do anything. The truth is in between that. The truth is, what does it mean for you? And are you literally able to embrace that you're better at a lot of things as you've gotten older? You think back on how you cope with things. When you were 16, a lot of things you couldn't cope with. Now you're the wise elder that maybe in your family people actually could ask your opinion on how do you cope with all these things, with jobs, relationships, financial problems. A lot of cultures of, quote, Native Americans, they didn't even ask people for advice unless they had their first wrinkle. Now we put Botox under the skin, which is actually a poison, to get rid of wrinkles. It's as if older people, because they can't figure out the new smartphone or the new device, or they can't figure out how to put Lyft or Uber on their phone, that somehow then their wisdom means nothing. And I find that as a gerontologist tragic. One of the books that I wrote was called Sagacity, The Passing On of Wisdom. Well, what actually is wisdom, and can you pass it on at 30 the way that you can at 80? My bias is no, you can't. And yet when I asked the clients permission to use their stories, the saddest thing of all was they said, would anybody actually care about my story? So I want you to feel like you actually do care about sharing what you have. It's amazing the things that you've lived through, to embrace that. Because all these younger people that may kind of not think of you in that way, they're all likely to get there. People are aging at a slower rate. The life expectancy continues to go up. So if you can be the wise elder for the people in your family, literally that's something then that they can look forward to. It's very hard on younger people to see somebody that they looked up to as becoming debilitated or really not aging well. And a lot of, again, aging well is recognizing that some of these things do change, but it's not necessarily a bad thing. Is it bad to be slower? Maybe that makes you more thoughtful. Maybe that gives you more time to be with your grandchildren and to really perform what President Obama used to talk a lot about, the influence of being raised by his grandparents. A lot of gerontologists, myself included, were raised by grandparents, so we didn't grow up with this negative view of aging. But wow, when you think about what seniors advertise on television again, such negative things. With my own grandson who just turned 10, he looks at me like, oh, you're 50 years older than I am, as if that's like 5,000 or something to a child. And so imagine when I can still carry him around and do all these things with him, his image again of aging is a positive one. So the bottom line of this show is, well, what does well mean, to age well? Is it like getting a steak done well? Well, that can be different things for different people. But it's literally that it's a positive thing, because you're all going to do it. If you watch this show every week you're going to be a week older. There's nothing that you can do about that except dying. That is the only treatment for aging. So all these folks that tell you that they have this secret on how to fight aging, how to defy aging, how to slow down aging, are doing something that all my years of training and practice, I don't see how that's possible. Aging is aging. And that everybody's different. The older you are, the more like yourself you are. So when I used to be interviewed years ago by the media, they'd always want to know, how old are you? I'd refuse to tell them, because that in of itself is discrimination. It's like, if you knew that I was 39 saying these things, you might see me very different than at 59 or at 89. And you're pigeonholing me, you're stereotyping me based on what you think is appropriate for someone that age. Well, if the life expectancy was 48 and I'm 59, wow, I'm pretty old. But then there's people like, they even say that we celebrate July 4th instead of maybe June 4th for Independence Day because of Benjamin Franklin, because he was in his 70s. Imagine that, in the 1700s, and he had really bad gout. And so he often was not able to sit for long periods of time. That's a real inflammation, often in his case, I think, in his feet. And so they kept delaying meeting and meeting because of him. So even something like that can have an impact on our own history. I love to remind people that there's always been old people. There's just more of them now. There have always been people that lived a long time. And that was before, obviously, all these modern techniques and things. So in wrapping up here, what we're going to be covering in the coming weeks are just all kinds of topics about aging. And I welcome your comments and suggestions of things that you would like to hear about, ranging from end-of-life issues to exercise to acupuncture to how to deal with your children that are trying to tell you what to do, how to deal with taking care maybe of your parents while you're taking care of your minor children or millennial children, what that's like for you, what it's like to live in an urban area where you walk into a department store, the few that still exist, and they hand you something and say, here, sir or ma'am, here's this rescue lotion to put on your face. And you're being told that you're not okay the way that you look, and how people manage that with all the different techniques and things. We're also going to be inviting people to interact with our guests that come again from a variety of backgrounds, professional as well as personal, for you to realize that It's not just one perspective. And all of these views are my opinion over many years of research, practice, and teaching. But you still, as the wise elder, you're the best expert on your own body, on your own mind. Nobody has lived as long as you have in this body. So that's why if you don't really like what someone is advising you, get another opinion, get another opinion. And in my opinion, ask somebody who's older, because they've been around. They've coped with all these different kinds of things. I often imagine what it would be like, right? To be 100 and thinking that 59 is old. Thank you.